Hi, we're here with Dr. Chris Tisdell, who's an expert in mathematics at UNSW. And Chris is here today with us to talk about the real-world applications of maths in catastrophes. And we're going to be focusing on the recent Ebola crisis, the outbreak in West Africa. Now, Ebola is a disease that's transmitted through virus, and the virus is transmitted from person to person only via direct contact with the blood or bodily fluids of a person who is infected or dead from the disease. So Chris, to start us off, could you tell us about how maths in general can be applied to containing epidemics and predicting epidemic growth?
So with catastrophes like this, maths can help us understand what's going on now and can also help us understand what's going to happen in the future.
How do you think Ebola can be stopped using maths?
Well, again, mathematics can give us the answers here. Recent studies are done by the CDC, the Center for Disease Control and Prevention in the US, have revealed that if we can isolate and treat 70% of Ebola cases, then we can stop the epidemic. The more that number keeps growing, the harder it is to treat that 70%. So the 70% keeps growing as well. I think it's possible if governments can commit the necessary resources. Now, one reason for the disease spreading so quickly in parts of West Africa is the decay of the health systems there through poverty and civil war.
Of course.
I think they need help from countries like Australia, etc., to put the resources that are necessary into stopping the epidemic.
Yeah.
And again, maths tells us that 70% is necessary.
So let's talk a little bit more about predicting the rate of growth of Ebola. Are there any current mathematical models that can show this, and what do you think about those, or how accurate are they?
So at the moment, it's critical to get good data, which can be a challenge when there's all sorts of problems in the West African region.
Yes.
So at the moment, we're working on an exponential growth type model where there's an idea called doubling time. So at the moment, the doubling time of Ebola is about 14 days. And so what that means is every 2 weeks, the number of Ebola cases doubles. So it gets out of control pretty quick. The doubling time that I've mentioned is for the most severe parts of the region where Ebola is spreading quite quickly.
Right.
In other countries or regions, the doubling time may be 30 days or 20 days or something like this. What's important here is to get good data. There is a feeling that some of a number of cases are underreported, and then model that data and then resource it appropriately.
So do you think governments are actually using these mathematical models and utilizing mathematicians effectively enough currently to try and stop this epidemic?
That's a good question. Part of me wants to say they could always do more.
Of course.
I think this conversation highlights the importance of mathematics, not just in an esoterical, far-out sense. It has really important economic, health, and resourcing implications to really understand the maths that describes what's happening in our world, like an Ebola crisis.